the Region 2 Area Agency on Aging, Julie Weatherby. Hi, Julie.
Hi.
Welcome back.
Thank you.
Great to have you with us, and you're one of the agencies that is continuing to provide services. You're still open.
Yes, our agency is considered an essential service because we provide services to older adults and adults with disabilities in their homes so they can remain in their homes in the community. So yes, we're closed to visitors, but we are available by phone, so we express to everyone to reach out to us. We're still taking calls, still doing intake and referral, adding people to our programs, and just overall generally helping people find the resources they need.
So what kinds of things are you hearing? How's the department responding to the needs of your community?
Okay, well, our calls are down a little bit right now, but we're expecting them to increase. I think people are confused about who's open and who's not open, but we are open. The types of things we're hearing are more folks are having food insecurities, so we're referring more folks to the Jackson Department on Aging for home delivered meals and making sure that they have food in their home. We've had a few other calls for needs like milk, eggs. Folks are afraid to go out because they've been instructed to stay at home. So we facilitated getting people those types of things, even things like cat food or dog food. You know, pets are important to the people we serve and our community members. So we're making sure those needs are met too.
All of us now are probably experiencing what all of your typical clients experience, and that is being trapped at home.
Right. So, you know, social isolation is always something that we're concerned about for the people we serve. It's even more so now because people are being instructed to stay home unless it's necessary to go out. So something that we've just started recently, it was in our plan to do later this year, but we've started it sooner, is called Friendly Reassurance. So anybody can call us and sign up for that, and that's where a staff member or a volunteer will call folks and just check on them once a week or whatever the person would like the frequencies of the calls to be, and we're making that happen. So because we know being isolated, it affects people's health as well.
Yeah, and that's the way to do it, by telephone, because I think most people are nervous, particularly there are probably those that you serve who might not have perfect health.
Right.
And they don't want someone coming to the door.
Exactly. So the folks we serve, normally we would have direct care workers going right to their homes and helping them with their activities of daily living, but that's a choice for folks. So we're finding some people now are saying, no, don't come in for a while, but please call us. So we're respecting people's wishes for the safety of the participants as well as the direct care workers, so that, you know, they're not going and exposing people to the coronavirus.
Oh, it's sad to hear, because there are those that need that help to
Right.
prepare the meal or to whatever
Right.
assistance that they depend on someone else for.
Yeah, so sometimes now they may have another family member in the home that's helping them with those tasks now. But in other cases, we're still providing care and making sure, you know, as best we can, that folks have the personal protection equipment they need to be safe when they visit.
Well, I know you too are concerned about people who might not have really had any contact with your agency ever and suddenly find themselves in needing
Right.
some sort of service.
Right. So we're really encouraging people to call. We're very connected with our other community partners in Jackson County. So if we can't help, we'll find somebody that can help the person that's calling, or make other arrangemements. So, you know, we just encourage people to call to see what's out there. You know, we are hearing, you know, there's more need now for home delivered meals. So we're working closely with the Jackson Department on Aging to make sure, and they're still providing home delivered meals. So that's happening.
And that sounds like it might be an opportunity for people who have the means to order from one of the restaurants that started doing home delivery because of the...
And that's always an option. All the takeout options in the community, you know, are valid for people to use and get home delivered, and it's important for our businesses as well.
So you do depend a lot on volunteers at Region 2 Area Agency on Aging. Do you need more?
We are taking referrals for volunteers. I know at the state level they've launched a state website where people can volunteer. Yesterday we had somebody on our Facebook post offer to volunteer and help with a friendly reassurance. So yeah, we're always considering volunteers for the friendly reassurance, for our Medicare Medicaid assistance program. We do community education. So we use volunteers a lot. So I just invite people to reach out to us by phone or by email or however they want to reach out to us, because we can always use more.
There are a lot of seniors that are great online and they have a smartphone and they're able to do all the online services, but there are a lot, including my mom. She's able to do some games and but doesn't really use the internet fully.
Right.
So those people that really are looking for help and they're being directed to go online to this department or that,
Right.
What can you do to help them?
We can walk them through that. We still do most of our assistance by phone. Now we can't do so much in person, but by phone. So we just encourage people to call. We do have people that are experts in assistive technology and those types of things, and there's a lot we can do over the phone, or if a caregiver in the home can help facilitate a conversation or getting online, that too. But it's funny, we just had an all-staff meeting today and we were talking about, it's a different world out there, and a lot of our community education was in person, but we're thinking about doing some webinars and some things like that because we're feeling like people need the opportunities to connect. So we're looking at different options in this world right now we're in.
Yeah, and everybody was in the middle of something when the world stopped.
Right.
And that includes people transitioning to nursing facilities, people coming from a hospital to rehab, people moving to a new apartment, buying a car, a new job.
Right. We had, in fact, this week we had a call with a couple people from Henry Ford Allegiance Health and Adult Protective Services and some of my staff, and we were talking through helping for seniors as they're transitioning out of the hospital and how we can be a referral source too, because we help a lot with making sure the folks have meals when they get home and other services. Did they get their prescriptions filled? Those types of things. So we, are working with our community partners to make sure those transitions are as easy as they can be.
You do have a lot of partners. I was looking through the list on your website earlier.
Yeah. We work closely, and I have to give a shout out to, Zoe Lyons at DHS. She's like the emergency planner in the Jackson County. She's doing a great job of bringing us all together to talk about who's open, who's not, collecting donations, getting people what they need. So we are part of those conversations as well.
A lot of the people you serve are those with disabilities. What are some of the things maybe we haven't thought about that might be impacting their lives that you're able to help with?
Well, some of the things that impact them are, maybe their caregiver is sick and can't get into their home to assist, so they have to rely on whoever their emergency backup is. So that can be, an issue, or, maybe some of the calls or things aren't working out. So that's why we're encouraging people to call so that we can help through that. Meals and food insecurities we're hearing a lot about, and then toilet paper. We've had calls to the agency for toilet paper, and we've actually delivered a few times. So just whatever people need, we're trying to work through it and work with, the food pantries and the other donation sites to see what we can get people.
Yeah, the toilet paper thing, it's such an annoyance, and it's, and for some people it's all they can think about.
Right.
Yeah.
It's top of mind and they need it, so.
So, if you can help people, everyone's probably got someone they know related to or lives near them that is senior or elderly and could use. How do you advise we approach people that might be neighbors and how we could best offer help?
I think reaching out, connecting, calling them. I know my husband and I have a neighbor, and we called before we were making a run to the store and said, hey, can we grab something for you while you're out? Just checking with them to see what they need or what we can help provide.
Yeah, so a lot of you sitting at home just chomping at the bit to go to the store, but knowing you really don't have to. Maybe you have a neighbor that needs something. So there's your reason to go and your reason to help. And your phone, that's one
Yeah.
of the things too, your phone gets answered, which is really nice.
Yeah, we still have, we have a lot of our staff working remotely, but that's not obvious to people calling us. We're still answering the phone and we're calling people back and we're still open. The other thing is, another concern is with people is picking up their medications. And so an errand like that for somebody that can't get out to go to the pharmacy or check on a delivery service for people so that they aren't short on their medications.
Good thought. Thanks for all the updates, and I know we'll be staying in touch with you.
Yeah, thank you so much.
Thanks, Julie.
Thank you.
Julie Weatherby is the CEO of the Region 2 Area Agency on Aging, and the Region 2 is Jackson, Lenawee, Hillsdale counties. Thank you so much.
Thank you.
We've got lots more still to come. Earlier today, the Jackson County Health Department reported the number of positive COVID-19 cases in Jackson County